Welcome everybody to the seminar today. This is the conversation on healthcare access in the Maasai Mara, Kenya with Nashualai Maasai Conservancy. My name is Katie Adams and I'm Program Manager in the Sparkman Center for Global Health. The event today is being co-hosted by the Sparkman Center, the Lister Health Center for Health Policy, and the Office of Public Health Practice. And it's part of the Global Health Case Competition, which is taking place this Saturday. Global Health Case Competitions have been an annual program at UAB for over 10 years, but this is the first year that we are partnering directly with an organization on the ground who helped us identify health issues and challenges in their community. And that is how we constructed the case for this year. So it is very much based in reality, based in the current needs that a community is facing. And we're so honored to have these folks here today to talk directly to us, joining us from Kenya where it is 9 p.m. But first I will hand it over to Dr. Stacy Moak, who's here with us. She is a professor in political science and public administration in the College of Arts and Sciences and runs the Education Abroad course, which visits the Maasai Mara. And so she'll talk a little bit about that before jumping into the conversation.
Well, hello everyone, and welcome to this webinar. I am so excited to be here and very excited to see my partners in Kenya that I don't get to see nearly as much as I would like to. So just by way of introduction to the program for study abroad, we organize this program so that students are in class in the spring semester. We are currently meeting on Tuesday nights, and they learn about African politics. They learn about issues related to women, to women's health, to access issues for health issues, and women's engagement in economy and politics and all of that in the first segment of the class. In the second segment of the class, in the academic part, they work on a service learning project that is a partnership with Maggie's Women's Empowerment Movement and our students. In the past, we have worked on menstrual health management, where we work toward developing, was actually learning to sew reusable sanitary pads that then the schoolgirls can have to keep them in school. And we will probably be doing a version of that same project this year, but we still have the planning to go. And then the last component of the class is that students do travel to Kenya. They go for this year, we're going to go from May the 1st to the 16th. We will spend about a week out at Maasai Mara, visiting with the schoolgirls and the schools and going on safari and staying in the Old Arpoi camp and really interacting with Maasai people. And then we'll spend about 4 days back in Nairobi doing some other cultural events and seeing baby elephants and giraffes and things like that. And hopefully also tour, spending a day at Kara Rescue Center, which is another rescue center in a different part of Maasai, of the Maasai area. But we have a partner there that we like to see if we can make all that work out. So what we are going to do for the rest of this program, I'm really going to turn it over to Maggie and Nelson. And then if I need to ask questions or whatever, to keep the conversation going, I can do that. But in my experience, these two can speak about their projects very well. So why don't you start off by telling us, telling the audience about Nashualai Conservancy, and then move from that into the health issues and healthcare access issues that you have noticed in your community.
Good morning, good evening from Nairobi. We are very proud of the relationship that our organization, Nashulai Maasai Conservancy, has with UAB. And we are really happy that we will be hosting the students who are coming in May with Dr. Moak. So it's a very important relationship, and I want to thank all the players for that contribution. So here with me is my partner, my wife, Maggie. We've been working together at the Nashulai Conservancy. I am the CEO, Chief Executive Officer, and co-founder of the Conservancy. And she is the director in charge of the Women Empowerment Program. So basically, the Nashulai Maasai Conservancy is the first community-led Maasai Conservancy in Maasai Mara, whose purpose is to conserve wildlife or ecosystem, preserve the local culture of the Maasai people, and reverse poverty.
It seems like we've lost our connection with Maggie and Nelson, so just bear with us for one moment while we're waiting for them to get their technical issues straightened out and come back with us. I can kind of jump in a little bit because of the long history I've had with Maasai Conservancy. I know several of their projects. First of all, what Nelson was explaining is that they are the first Maasai Conservancy that is community owned and community led. This is a significant issue in the Maasai area because many camps and lodges come onto the protected lands of the Maasai, and they convince the Maasai to sell them their land. And then they move the Maasai people out and have tourist lodges and camps that don't benefit the people, only benefit the proprietors of those facilities. This is a very different model for the Maasai at Nashualai. It's a partnership between the ethnic community and the Conservancy, where the Conservancy has been able to solicit donations from international partners so that they can pay people to be a part of the Conservancy. And therefore, the people are able to reinvest that money that is paid to them to lease their land back into their children, their homes, their communities. They're able to educate their children. And the Conservancy has a practice of man and animal living together the way that things were in ancient times. So the Maasai don't have to leave the land to be able to stay on the land. And the cattle and sheep and goats from the Maasai people coexist in the same area with wildlife. And the ecosystem is preserved because the wildlife are able to have their natural corridors of migration. The Conservancy has helped facilitate the removal of many, many fences that were blocking the wildlife from their natural migration corridors. So there's been a return of wildlife back into the area, which if this had not occurred, these species may have been lost forever, or at least would have been lost to this specific area. So that was a very important mission of Nashualai, was the conservation of wildlife and the protection of this wildlife corridor. In addition to that, there is a big focus from the projects that Maggie and Nelson run to preserve the indigenous Maasai community. One of the projects that Nelson has worked on for a while is the idea of a stories cafe. And in the stories cafe, the elders would state their stories to impart their indigenous knowledge to future generations, so that all the things that have made this a strong and proud ethnic community would not be lost to the future. The Conservancy definitely has the idea that history should not be lost in the name of progress. So in the Stories Cafe, then the elders would be able to record their indigenous knowledge so that it wouldn't be lost in future generations. And this is a really important piece of preserving culture. There are many beautiful traditional things from the Maasai people, lots of knowledge about use of herbs and plants and all sorts of things that we don't want to lose in the name of progress. The final piece that Nelson mentioned before we lost them was to reverse poverty. In this area that we're talking about, people still, it's very much a pastoral community. So the people herd animals, and there's not very much of a cash society. So there's a lot of poverty, high level of poverty. Nashualai Conservancy has put in a training center. Hi, Nelson, can you hear me now?
I can hear you. Can you hear?
Okay, so I was talking about, I've already kind of talked about the wildlife stuff and the preservation culture. So I'm on the reversing poverty. So if you want to start there and pick up and you tell the story.
Yeah, you did very well. And I don't know, we could hear you and we are actually seeing you. So we've been working very hard to reverse poverty through a number of programs which are aiming at the women, education. And I would say that one very important thing that the Conservancy was able to do for the community was to launch a relief food program during COVID, when COVID struck. And all the communal markets were closed, slaughterhouses, international travel was banned, and no tourists were coming to the Maasai Mara. People were staring at starvation on the face. And we appealed to a huge network of our friends and launched a feeding program which provided relief food to the most vulnerable families. Initially, we were looking into feeding only 3,000 members of our community, but the need was so big, and our own community of 3,000 members said they cannot eat alone. And therefore we scaled up the program, and it ended up putting 28,000 people on a feeding program that was taking place weekly for twice a week for 1 year until normal activities resume back again. And now the community is strengthened again, and we are trying to improve on food security through kitchen gardens, encouraging the local community, who are usually nomadic pastoralists, to explore new opportunities in having kitchen gardens in every homestead, so that they can take care of their food requirements. So we are working hard on food security. One other important thing that we are doing, and we thought that we can work well together with the University of Alabama and other partners, is to develop a healthcare program for elders, because we have realized that as changes are coming to the Maasai community, education and movement as people move out of the villages to go to the cities. So the elders have been vulnerable. So we are thinking of coming up with a healthcare program for elders, whereby in the Stories Cafe, when the elders are coming to share their stories, then they can actually have a place of care where we can give them nutritional care, food, and upkeep, so that they can live really in a meaningful way. They are getting taken care of, and they're also able to share their story. And Maggie, on the other hand, has been working on issues of women empowerment, which she can talk about, addressing female genital mutilation, girls' education, and she can be able to speak about that.
Yeah, so as Nelson has just introduced Nashualai and what we do there, our values, our core values are then to, preserve, to conserve wildlife, preserve culture, and reverse poverty. And an aspect of poverty, reversing poverty then becomes education. We all know that an educated community is empowered. And an educated community that is both boys and girls became paramount within my office. We had to make sure that we have girls having an education, we have boys having an education, and we have projects running for women empowerment. That way we are able to educate women who have never stepped to a classroom on, projects that will draw benefits to them directly, draw benefits to the girls. And that way, we have a strong community. And such a project, for example, is on sexual reproductive health management. We are training girls about their rights, about their bodies, We are making sanitary towels that they so much need to stay in school. It's unbelievable that, during that time of the month, most girls will miss school simply because they don't have, the right things to use during their menses. And this is shameful. So this is keeping them away from school. And once they're out of school, the boys go on doing their studies, outshine the girls. And so we know that if we put such projects in place to cater for our girls as well, they will remain in school, and they will be productive, they will do well, and they will graduate from college, come back and give back to the community. So that is one of them. We as well have projects like beehives for the women who never had an education, poultry keeping as well. So we are keeping chicken for nutrition purposes, for them to be healthy. We have chicken, we for food security. We have community gardens for nutrition purposes. We're teaching them how to do just little kitchen gardens. And then they're able to feed their families with the right kind of diet. And then they will grow well. The children will grow and, live their lives happily. So such projects are in place within Nashulai Maasai Conservancy to educate and to empower the community, because we know that education is power, education is key. Once they have an education, they're able to, hold together and take care of their families.
Further to what Maggie has just explained, so in as much as we embracing education and supporting the community in that way, we are also preserving our culture. And I think Stacey had explained and spoken about the Stories Cafe, which we are calling Netiapa. So the Stories Cafe is a project where we have established a cultural center for the elders of the community to pass the indigenous knowledge to the younger generation, because it's very important that as our community embraces modern education, we also want to keep our culture, which we draw from a lot of fallible knowledge systems, which we do not wish to see dying in our time. And so besides the Stories Cafe, we have also developed an educational institute within the Conservancy to educate the local youth with skills and knowledge to work, to get employment and jobs in the Mara. In the last 10 or so many years, we have noted a situation whereby our young people are actually not getting employment opportunities in the big tourism industry in the Mara, because there has been some sort of a segregation. People from other counties, other cities are brought to work in the Mara. Usually on the claim that the local youth do not have the requisite skills to work in the Mara. So we are changing that trend by running an institution which is educating our youth to work in the Mara. And one beneficial aspect of that arrangement is that then our young people do not need to relocate to the cities. They can remain to work in their land and not lose their culture and to help their community to move forward. So beside that, we have ecotourism activities and projects. One key project that we are running in the Conservancy is our own lodge, which is run on ecotourism, eco principles, the Old Akwemara camp, which is employing the local people. Altogether, the projects that we are running in Nashualai are empowering through employment and other beneficial aspects, more than 3,000 people within the Conservancy. So, so we are really just happy to also just throw back in case we have another breakdown in technology so that we can answer any questions that you might have.
Well, Nelson, I'd like to ask you a question to share a little bit, because many of our viewers likely have not been anywhere near the Mara area. Can you describe what the structure of healthcare is or has been in your community up to this point?
That's a very good question, Stacy. So the structure of healthcare in our community has been very scarce. We don't have hospitals or clinics. Well, there is an American missionary who tried to start a small clinic to help the community, but unfortunately is charging quite some high fees. So most people prefers to just go to the government clinic. The nearest hospital is in Narok, which is a day's trip from Sekenani. So so it's not very well established, and we are hoping that as Nashualai, one thing that we hope to do is to establish a small clinic in the near future to offer nutritional or public health care to the community, just even to address basic issues of nutrition and hygiene and such simple things, which are very important in contributing to good health. Because if someone get malaria or some other ailment, then they have to travel to Narok, which is about 100 kilometers away. So we don't have an established healthcare facility or program in our village. Yeah, so most...
traditionally, how has your community viewed healthcare? I mean, when we think of healthcare in the United States, we usually think of doctors and nurses and things like that. But what has been the traditional form of healthcare in your community?
Okay, Maggie's answering that.
Okay, so what it is like in our community, we have medicine men who are so good in noticing, herbs that can cure various diseases. So in each and every village, we then have a medicine man and woman who are quite aware of the herbs in the forest. And the community members will stream to this village and come and seek help from these people who are knowledgeable on the same. And interestingly, not way back, it's quite good because that is how the people survived. They will go to this medicine men and they are given medicine, and that worked for them until hospitals came, not so long ago. Yeah, or if they don't get well through their medicine men, they will then travel to a nearby town, which is Narok, a headquarters where they have a hospital, a referral hospital, when everything else is not working.
Well, we have a couple of questions that have come into the Q&A. So one of the questions is what is the availability of electricity within the village and the conservancy area?
Solar.
Sorry, what is?
What is the availability of electricity within the villages and the conservancy area?
Okay, so presently we are relying on solar energy. So it's mostly solar energy. We don't have an established system of electricity as yet. Most families, an interesting aspect that you will notice is we have what we call the lion lights. So if you come to the Mara at night, you'll see blinking lights around the villages. So basically, these are lights which blinks on and off throughout the night to protect the villages, which we call the bombers, from lion attack. So, we just mostly depend either on solar or firewood for lighting at present.
Yeah, although the government rolled out education that's going to public spaces, like primary schools, health centers, but it's not sustainable. I mean, it's power that comes for a day and it's not there the following day. So we are still quite dependent on solar power, and the villagers are depending on firewood for light.
And so a follow-up question that's kind of in the same vein of that, someone asked, how accessible is water to the people in the conservancy?
Yeah, can I hold? So we are good with water, because one of the things that the Conservancy did was to launch a clean water program for the villages. So we have simply channeled water from the springs at Alderpoy Camp, which is the main source of a certain river. And then the water is channeled into underground tanks. Then it's pumped by solar panel to an overhead tank, which is located on a mountain. And then from there, the water is distributed by the flow of gravity down to the villages below. So that has been having a very good impact on the community.
Another question. I mean, it looks like there are lots of questions here, so I'm going to just keep asking them one after the other. Yeah. It says, if someone goes to the hospital, how do they get there? Do they have to walk? Is there a bike or transportation? How do they get to the hospital?
Yeah, that's a good question. So there are several ways to get to the hospital. You have to take a matatu, okay? So matatu is a public bus, a shared taxi. Or if they give a call to the Conservancy, we have a motorbike taxi, which we call a boda boda, and it has a little carriage, a small pull, a cart that the motorbike, pulls at the back, and therefore we mostly use that motorbike as a rescue service or an ambulance service to transport pregnant women who almost giving birth to a hospital. But usually they would travel to hospital by using matatus.
Or walking even.
Or walking.
Some people walk quite a distance to get to hospital. You can find a woman who is in labor and her village is quite far away from the hospital, and they have to walk for a day or for 8 hours to get to, a medical facility.
Maggie, do you still have your motorcycle ambulance that you have?
Yes, we still have our motorcycle ambulance, which comes in handy, because when a village is, sometimes villages don't even have roads. They don't have a road that leads there. So it's only through, such an ambulance, a motorcycle with a cart at the back, that we can get to the village and get, that lady or child and take them to hospital. So it's quite rural. Some villages don't even have a road. That's why the motorcycle came in handy.
Someone asked, where do you purchase or get medicine for things that people need? Who's the supplier of medicine? How do people get actual medicines?
Well, as explained earlier, a common way of getting treatment when people are sick is to visit the local village medicine person. Okay, and usually if the ailment of the sick person does not respond to the treatment, then they will have to go to the mission hospital. There is a small mission clinic operated by an American missionary who is running a small clinic. Unfortunately, the fees charged at that clinic are quite high, so mostly people do not afford. So they would try to go to the Narok clinic, okay, which is about 100 kilometers away. But otherwise, in Kenya, the supply of medicine is controlled by the government. So it's not easy to just order medical care or equipment or medicine because it's really regulated. So someone would need to go to a registered hospital or clinic to get whatever healthcare that they need.
Are vaccines available there yet for COVID to the general population?
They have started to be, they started rolling out their vaccine programs. So recently there was a COVID breakout in the villages. So luckily, the government of Kenya has been working very, very hard to roll out a vaccination program. And they have made it really very strict that you need to get a vaccine if you need to access facilities and social places. You need to have a COVID, a vaccination certificate. So they have begun to roll out vaccination programs in the Mara. So that is a plus.
And are people accepting of that, or do they reject this? In the United States, we have a lot of vaccine resistancy. So how does that play out there in the Mara?
Okay, so many people are accepted to the vaccine, but as you know, there are of course a few people that are rigid, maybe because of their own beliefs, maybe because of religion. But we have seen quite a good number of people turn out for COVID vaccination. And I think it's quite good because when Omicron hit, most people were vaccinated. And so it ended up just being, a flu. Yeah. Nobody was badly affected by the Omicron variant. So again, it's because people agreed to the vaccination. Mm-hmm. They realized it's very important for their lives.
In your discussion, you mentioned how COVID disrupted the food supply, but how did it disrupt your education programs and hygiene goals?
Yeah, our schools and educational programs were suspended for close to 1 year. So we did not have any ongoing educational programs. And they have actually just resumed last year. So, so this was, this was affected, and the kids are just trying to, catch up. They have lost a whole school year, year calendar, but the government has come up with a system whereby the children are able to recover the lost year due to the closure of schools because of COVID.
Yeah, and not only that, I have to say that the pandemic also disrupted, their livelihoods, because we had students staying at home for quite a long time, which was not usual. They were very idle at that particular time. They didn't know what to do, although we tried so hard to facilitate trainings like the sexual reproductive health trainings, so to engage them. So again, we saw a lot of teen pregnancies at this particular time. We saw girls drop out of school. Not only girls, we had boys who were idle for long and ended up indulging in, other activities that were not compatible with education. So those are the few setbacks and challenges we experienced, during that COVID time.
Okay, as far as your elders go, what types of health problems specifically are you noticing in your elder population?
Yeah, so that's a good question. I think that there are the issues of diabetes. Diabetes is on the rise. I think it's because of the change in lifestyle and diet. So, for the longest time, our traditional community relied on an organic diet. Most of their nutritional requirements were obtained organically from the ground, from the farm, or from livestock, which was grass-fed, if it was about milk or meat. But things are changing, and the Maasai are now having to grapple with a new reality, new diets and all that. So we have seen huge problems relating to diabetes, high blood pressure, eye diseases, ailments, trachoma. We also have, problems relating to malaria. Malaria is a prevalent condition. We have also seen high prevalence of waterborne diseases,
because of pollution.
Because of river pollution. And we try to do something about the river. During COVID, apart from supplying food to the community, we also engaged the youth and women in a river cleanup exercise where they pulled out tons of garbage from the river. And believe you me, it was, the community could not believe that all that toxic garbage has been lying buried in the river, and they were drinking from that river. And then after cleaning the river, they planted bamboo seedlings to help in the purification of the water and regeneration of nature, just so that the health of the ecosystem can be restored. Mm-hmm. So, we have seen that prevalence in waterborne diseases, typhoid and all those. Those are the main ailments, serious ailments that we can see with the people.
Yeah, we've also observed, challenges with dental health. Yeah. A long time ago, the Maasai drank milk. Their diet was quite friendly to their, to their dental formula. And now the Maasai people are living in, rural, like urban centers, like shopping centers, where children are accessing candy and a lot of things, and they are not taught about oral hygiene. They are not brushing their teeth. Just the other day, I visited a clinic that's run by the World Health Dental Organization, and the doctors there who are volunteers are saying that they are seeing this becoming quite a challenge. The Maasai people are having, dental problems, and that is another thing that could be addressed because it's very new to the Maasai, and we all know that it's quite, expensive to even take care of dental issues.
Yeah.
As far as the structure of the villages, there was a question in here about, are people really compact or are they spread out? And can you describe like how villages are assembled in your area?
Yeah, so, in the past, the community lived in large open spaces, which were shared communally, and that was very important to support the nomadic lifestyle of the community, because the Maasai are traditionally a pastoral community which keeps livestock, sheep, goats, cattle. And for them to do that, they need huge tracts of land, which were owned communally and shared by all the villages, with equal access to the pasture land, to water. But in the last 10, 15 years, we have seen a trend where the system of land ownership changed. You know, there was agitation from the government to actually change the ownership of land from communal group ranches into private land ownership, so that each family, each member of the community would end up owning a small parcel of land. Therefore, because of that, we have seen fragmentation of the living spaces. And unfortunately, there has also been a trend where land has been commodified through selling and subdivision, and outsiders from the towns and outside have actually moved in and developed certain aspects of development which are different or which are not really in consistency with the Maasai traditional lifestyle. So in that case, villages are becoming scattered, okay, as families find themselves isolated, living in their own space. And culturally, that is something that is new to the Maasai community. So our conservancy, Nashualai, was trying to bring back that sense of commonality where people, wildlife, livestock can come back again together in one space to share and remove fences and open up spaces. So the community at Nashualai lives in together, and they are sharing, in enclosed villages, not scattered all over the place. They're living in communities, all right?
About how many people in a community, as you're referring to a community?
Yeah, so for example, in Nashualai, we have about 10 villages, 10 to 15 villages, and each village has about 100 people.
170.
100, yeah.
And Nelson, when you're talking about villages, is that what I'm remembering, like the circle with the small house?
Yeah.
Can you describe that for our listeners?
Yeah, so in the sense of a Maasai village, so we have a collection of houses which are arranged in a circle, okay? And that the village concept of the Maasai is called a manyata, okay? So it has about 100 or so houses, okay? And then to protect the village from wildlife and all that, it is usually fenced with acacia trees which has thorns, just to protect it from hyenas and lions. And then it's encircled with a ring of solar-based lights which blinks at night to scare away lions, because when lions look at the lights at night, then they think a person is shining a torch, and therefore they are scared and they don't break through the village. So it's a simple solution to protecting the village. Yeah.
So you have these circle villages within the larger, and you said you had how many, 10 to 15?
Yeah, 10 to 15 villages in Nashualai, and
so about 15,000 people.
Each with about 1,500.
I'm sorry, 1,500.
Yeah.
Mm-hmm. I can't do math today. We have two other questions that I want to get to, and I'm afraid we're going to run out of time. One of the questions is to describe how funding works at the Conservancy.
Okay. So that's a very important question. So how funding works is we have to identify a need that we are not able to cater for it ourselves. Like when we had the emergency with COVID and people are not able to, provide for themselves in terms of food sufficiency, then we had to appeal to friends and well-wishers. And then they would, collect small amount of money and send it to us, either to our organization or to PayPal or through Cover America, Charity Aid America, and then they will channel it to us. And then our elders would usually know how much has been contributed as a donation, and they will see to it that it is shared to meet the need that we had in place. But as Nashualai, we have always wanted to ensure that we are not captured by the big NGOs because then they will control our narrative, and our conservation narrative is to put the community at the very, very center of it all. So, but unfortunately for the big organizations, like, I don't know, I don't necessarily want to name, but if I have to say, like WWF or World Wildlife Fund or Africa Wildlife Fund, usually their concept of a conservancy is people out, livestock out, wildlife in, and tourists in for the benefit of investors and all that. But so we have been, we have been careful not to, go to those big organizations, because then they will change our trajectory. So instead, we have mostly just carried out crowdfunding, donations, which supported whatever emergency or whatever need we have at the moment. And then once we get the money, we will sit together with the whole community led by the elders to apply whatever funding we have gotten and ensure that it was applied to the, to meet the need, and then report back to the person who was giving us the donation.
Right. Another question, I'm just moving right along here, is how are cell phones used? Is there social media, calling, internet, etc.? And do the elders have access or know how to use this technology within the community?
Okay, the elders do not.
Maggie's just shaking her head.
The elders do not know how to use social media, although everyone has a mobile phone nowadays, because the connectivity of cellular network has been very good lately in the country, but they do not yet, it's expensive to have social media and all that. But we have trained our youth in the Conservancy to share pictures and share information on all our projects and activities, so that the world and our donors and whoever is supporting us get to know what is happening in the Conservancy. So we have trained a few youth in the Conservancy who are handling our social media requirements.
There's another question in the chat that's asking about what is the effect of cancer on the community, or what have you seen as far as cancer issues?
I would say that cancer is also rearing its ugly head into the community. And this is something that I will attribute to the change in lifestyle and the pollution. So in the past, we never heard of cancer in our community.
Very rare.
And in fact, very rare. And if it was there was even no word. There's no name for cancer in our language. But nowadays, we have seen several cases, especially cases, and it's really true. And that's a very good question, because we have lost many people to, especially the elders, to prostate cancer. Yeah, so that seems to be the major problem, prostate cancer. and breast cancer, which was
all types of cancers now.
but mostly prostate cancer,
Throat.
breast cancer,
Throat.
esophagus cancer.
Great. Thank you. I'm answering a question. I was just going to type the answer, because the question is, does the culture still rely heavily on nomadic patterns?
Not anymore, not that deeply as it used to be in the past, because of the change in the land ownership and because of fencing and due to conservancies, and because most conservancies are privately owned by investors and they do not allow the nomadic practice of the culture to take place.
But it is still a pastoral society largely.
It is a pastoral society, cattle, sheep, goats, and all that.
I want to thank the listeners, because it looks like everybody's hung in there with us. We do have these challenges when we're working across the globe. The fact that technology even allows us to do this is amazing. And so thanks for hanging in there and for bearing with us on this. Maggie and Nelson, if you guys are not able to join back in just a few minutes, I know I speak for all of us when I say thank you so much for sharing your time with us in virtually not quite the middle of the night, but at least the end of the day there in Kenya. We really appreciate your commitment to helping educate us around these issues in your voice, so that we can form partnerships and work together to create solutions that are culturally appropriate. Oh, I see them back. They're coming back. Yay!
Sorry.
We only have just a few minutes for you guys to say goodbye, because this thing's going to shut off right at 1 o'clock. So I'm just going to turn it over to you. I hope you heard me telling you thank you.
We heard you.
Okay. Well, I'm going to let you say goodbye.
Yeah, we just want to appreciate all of you and appreciate UAB. We are honored with this sort of partnership, and we look forward to furthering it, and do welcome all of you to visit with us in Kenya. When you come here, please just know that you have a second home, and you will enjoy the hospitality of the Maasai people. So thank you very much. Stay safe. And for Stacy and the group that you are bringing to Kenya in May, we look forward to seeing you. Karibu sana. Karibu is welcome.
And so we say thank you so much for your time, for all those questions. And thank you so much. And you're more than welcome to visit us when you come to Kenya.
And you can buy beautiful jewelry like I'm demonstrating. I had to represent, I know.
Thank you, Stacey.
Thank you. We will see you all soon.
See you.
Thank you, and have a good day.
Have a good day or a wonderful evening.